So today I want to talk to you about what is hypothyroidism. And I got all of this information from our pathophysiology book. So let's start by defining what the thyroid is. The thyroid is a butterfly-shaped gland located in the neck, and its primary function is to control the metabolism. Hypothyroidism is an underactive thyroid and develops when the thyroid gland fails to produce or secrete as much thyroxine as the body needs. So what I did is I drew a little cascade to show how our body produces thyroxine. So first the hypothalamus is stimulated and it produces TRH, or thyroid releasing hormone. It then acts on the anterior pituitary to release TSH, or thyroid stimulating hormone, which then acts on the thyroid and it produces T4, or thyroxine. Thyroxine is a hormone that directly affects our basal metabolic rate. The more thyroxine we have, the higher our basal metabolic rate is, and vice versa. There are two types of hypothyroidism. One is congenital and one is acquired. So let's start with the congenital hypothyroidism. This is a lack of thyroid gland or deficient TSH at birth. And what happens is your thyroid is not efficient enough, or you do not produce enough TSH, and it results in not enough T4, or a low basal metabolic rate. Congenital hypothyroidism is the primary cause of preventable mental retardation at birth. It happens in about 1 in 5,000 infants and is more prevalent in females than it is in males. And if you are diagnosed with this through a screening that you do at birth, then you are put on T4 supplementation, and if you are put on this within the first 6 weeks after birth, then you will have no signs of mental retardation later. The next kind is acquired hypothyroidism, and the most common cause of this is Hashimoto's thyroiditis, and this is an autoimmune disorder in which the thyroid gland may be totally destroyed by an autoimmunologic process. So, your thyroid is destroyed by your immune system and it doesn't produce enough T4, which then stimulates the hypothalamus to make more TRH and the pituitary to make more TSH, and results in not enough T4 and too much TSH. This then decreases your basal metabolic rate, and when that happens, here are the side effects. Your metabolic rate is decreased, and that results in increased cholesterol levels. Your cardiac output is decreased, which then leads to bradycardia and vasoconstriction. This leads to coarse and dry skin and hair, cold intolerance, and sweating. Your gastrointestinal function is decreased, which then leads to weight gain, decreased appetite, and constipation. And then it also has hypoventilation, mental and physical sluggishness, impaired growth as a child, swollen features, and a deep voice. If you are diagnosed with acquired hypothyroidism, there is help. You can be put on hormone therapy, and the hormone that you are put on is called levothyroxine. This can be through intramuscular or injection or tablets. And the primary adverse effects are nervousness, insomnia, tremor, tachycardia, palpitations, and the worst side effects that are life-threatening are arrhythmias and cardiac arrest. Basically what this drug does is it's just a chemically created T4, and what it does is just ups your T4 levels, and then that regulates your TSH levels, and it normalizes them until you are just a normal person. So that's what hypothyroidism is. Thank you.